Hey, Brandon Dolbeck with SpectrumForMed.com, and I've brought David back again. And today we're going to be showing you actually how to perform a microneedling session. We have Madison here, our guinea pig. She's volunteered to have her face done with microneedling. So let's get started.
All right, perfect. Hey guys, David from Aesthetic Solutions again, and I'm very excited. We're going to do some microneedling. And so you know what we can do with microneedling, several things. It's a really great universal tool for a lot of aesthetic procedures. To make it better and to assist you. So with microneedling itself, what we can do with a skincare product to start is we can create microcolumns or channels and push whatever product we want to get into the skin. Of course, we would make it about that client. Let's say you have someone who has very dry skin, a hyaluronic is fantastic for that. Let's say we're dealing with someone 50 plus, we would put like a growth factor, in their skin, give them whatever they need, when they need it, with that visit. So, and then from there, we're going to work on acne scars, we're going to improve skin laxity, we're going to work on stretch marks for the body, fine lines or wrinkles, pigmentation, and overall skin rejuvenation, because it really creates a lot more ATP in the skin, the adenosine triphosphates, as we know, the energy carrier of the cell. So great treatments. Also fantastic for PRP and stem cell. We want to get that into the skin for a higher level of skin rejuvenation. So let's get started. Here's the pen itself. Very simple. We're just going to put the tip on and it just goes right in. So 4 variables involved with microneedling, right? The first is we have depth, right? So we're going to start at a low level and we're going to test, and what we're looking for is some slight erythema in the skin to know we're being effective. So depth is important, all right? Speed is also important. That's the second variable. The deeper we go, the faster we create the motor to run so we can go up and down faster. Third is the pressure of your hand, and fourth is the speed of your hand. So it will vary for each patient that you're going to work on. So, all right, we have a client here who has pretty skin, but we're going to demonstrate how we're going to do this. So we've got a serum on her skin, and it's just for moisture. So I'm going to put this on, and what we're going to do is we're going to create, there's 2 ways to do treatments like this. The first would be a linear move, which would be on and then off in either direction, horizontal or vertical, or there's a lock-on move, all right? The technique here, because we want to get more product in the skin, is lock-on. So it's going to be like this. We're just going to start, and all we're going to do is just stay on the skin, and that's the key, all right? You don't want to come off here, or if you're going horizontal here, all right? We have many tips in this, and it's moving very fast. So for this to be, optimally effective, we want this to be on. And if you look, all right, we're already starting to get a little bit of slight erythema in the skin. That's a good thing. We want that. So we're going to continue on, and the face has contour, so I just need to bend my wrist so I can stay on. So the first technique is vertical movement. Second is horizontal. Again, I am bending my wrist, medium speed. I'm getting, again, some slight erythema in that skin, and I love that. So, side note, we don't have to make someone bleed all over the place to create skin rejuvenation. Every patient is going to be a little bit different, right? She has really nice skin, but we want to give her a higher level of rejuvenation. So with her, all we need, again, is just that slight erythema. If we have a deep acne, like an ice pick scar, acne scar, of course we're going to need to go deeper. If we're going to create more rejuvenation for collagen production, we want to be at about 1 to 1.5 millimeters to get into that level to create that. So we've done the vertical, we've done the horizontal, all right? Third is diagonal. Again, I'm bending my wrist forward and back to stay on the skin. And the 3 angles, that vertical, horizontal, and diagonal, allows me to create little micro holes in her skin to create a higher level of rejuvenation. Okay, so that's really it. It's a very simple procedure to do. Okay, so, all right, let me show you this real fast. We only have a little bit of slight erythema. So again, I want to be optimally effective. So With her skin, I'm gonna go just a little bit higher. So, like I was saying, depth-wise, all right, we're actually gonna go to just 0.25. My setting is gonna be the same. Turn that on. I'll use my left hand so my posture is in a good place, right? And now, all right, same thing. You feel that a little bit more? Okay, you doing okay? All right, cool. Same thing, guys. I am just bending my wrist forward and back, medium speed, again, staying on. As the angle changes, I have two choices. I can move her head, which I do, or I would use my other hand. And we just sweep the skin, come right over to the mouth. Same thing. She's getting a little bit more erythema, which is what I want. So next, again, horizontal. Just bend my wrist. A lot of facilities that have microderms, you know, a lot of our clients that we talk to, they think this is going to be a little bit more complicated than microderm. The truth is, it's easier because we've got this lock-on motion, and it makes the treatment a little quicker and easier to do. So we can see here, you know, I'm getting a little bit more, which is exactly what I want. Again, last will be diagonal. And the key, I can't emphasize it enough, stay on the skin. And we're doing great. This is gonna be a really nice treatment for her. And we'll just come right in, all the way over, okay? Perfect, all right? All right, so with her skin on her right side, we've got a little bit, just a real slight amount of erythema, and that's okay, but again, optimally effective. This is what I'm looking for. So that's perfect. All right, so we're back and we've worked on both sides of the face. You know, it feels good for her. We like to start there because there's a lot of subcutaneous. We've got good depth there, so there's no issues. Now we're gonna work on more of the center of the face. And the issue here, or that we have to be cognizant about, is bone. So lots and lots of nerve ending in bone, so we can actually turn our level down, which I'm going to, and we're gonna work on the chin, the upper lip, the nose, and the frontalis. And same thing we've been talking about, same procedure. I'm gonna turn it back down. So we're gonna come right in, and I'm just bending my wrist again. Work on both sides. Really simple. There's my vertical pass. I'll split it in two. Come here. Come there. Again, I'm getting some erythema I'm looking for, and then I go into my diagonal. And I'll come all the way up into that lip vermilion right at the base of that. That's done. The upper lip is a little bit more sensitive, so I tend to move just a little quicker because, like I said, it's more sensitive, all right? So will you push your lip down for me? Okay, perfect, all right? So I'm gonna work a little bit here. Good, you all right? I'll come right into the horizontal and then just go right into my diagonal. Fantastic. Same thing here. Again, she's got some of that pink I'm looking for. Vertical, horizontal, diagonal. With the nose, right? With the nose, what we don't do is we don't come across because noses are too hard. So what we'll do is we'll do our vertical. You're dealing with a lot of thin skin here, so be aware of that. Now with the horizontal, instead of coming all the way across, I'll just meet it halfway on this side, meet it halfway here, and then I do a cross, an X here for the diagonal. So fantastic there. We're gonna work into the glabella. Same thing, vertical, horizontal, and two X's. And then last, all right, is the frontalis. A little bit more sensitive, a bigger area, and again, thin for bone. So we'll come across, and then just get into my diagonal. Doing great. Oops, vertical. Horizontal, and my diagonal. And that's that part. There is one more area which I'm going to cover next. All right, guys. So last segment, and that's a very important, placement or area for a lot of women, which is their eyes. The beautiful thing about microneedling is that we can get right under the eye. All right, we're going to go very, very shallow. We go right back to zero, right? Because I don't want to get deep. I don't have to because the skin here is very thin. It breaks down first because it doesn't have the moisture or the oil glands the other skin has. So with this, we are going to do some linear moves because again, it's so thin. We're going to work that lower bleph and then upper. So it looks like this. We're just going to come right in and we're going to do just little sweeps. And as I go, with each sweep, I get a little closer to that lower lid margin. We'll just come right in, here, here, great, all right. A lot of women break down right there, great. Now I just come in on the brow bone and I can get on this other side, right in here, and I'm just looking for, again, some of that slight erythema. The only area you will never ever, no matter what, go on is the eyelid itself. It's the thinnest skin on the body, so we don't go there. Same thing on this side. From the inside out, we just do our little sweeps. See, and she's young, but eyes break down first. This area right there, I can affect for her. And that's fantastic. Right in here, get there. If I need to use my hands, I can pull back the skin on that lower or upper and just get that area. So it's there. Perfect. And then after, all right, for post-care, we're not really going to do anything to the skin because we've got all these little tiny little holes. I don't want to put anything into that skin, all right? That goes for this, whether it's a skincare product, it goes for PRP, whatever you're doing, we're going to leave the skin alone. Tonight I would say to her, please use Gentle Cleanser. Tomorrow it would be Gentle Cleanser and sunscreen for the next several days. Okay, perfect. Okay, all right, so quick recap. I'm looking for, where I'm going to be for my next treatments. Overall, we're looking at anywhere from 3 to 4 treatments, depending on the patient. If there's a lot more work to be done, someone that's older and doesn't have as much, going on, as far as, being lucky for genes, we might have to do a little bit more. So with her, the adjustment I would make is I would go up one more level because I would want to see a little bit more. Same thing for the chin. If you notice here, I've got exactly what I'm looking for on the upper lip, the nose, and even the frontalis. And that's perfect. That's what I'm looking for overall. So we're looking at 4 to 6 weeks in between treatments. And I would recommend taking a picture before you start. After you do, let's just say we're gonna do 4, picture before, halfway, and then at the end, and then compare the end with that first picture, and they'll be very pleased, all right? It's awesome.
Okay, so if you have any questions, give us a call, 800-864-3894. Thank you.